Due to the Omicron wave, geriatric hospitals are at risk. Several heads of geriatric and hospice care organizations in Israel have cautioned that patients with COVID are getting inferior treatment owing to significant congestion, hundreds of personnel being quarantined, and a severe budget shortfall. Approximately 700 COVID patients are presently hospitalized in geriatric care facilities, with approximately 100 in critical condition. General hospitals have roughly 2,700 geriatric patients, with around 1,100 in critical condition. According to a previous Israel Hayom story, many COVID patients are never moved into specific COVID rooms but stay on regular hospitals, therefore their numbers are not included in the official statistics. They argue that unless the government provides considerable additional financing to cover increased coronavirus-related expenditures, geriatric and hospice facilities would face financial collapse. The government has reportedly refused to react to their pleas. In a statement to Israel Hayom, Dr. Galit Kaufman, head of the Maccabee Healthcare Fund's Assisted Living and Rehabilitation Network Beit Balif, said the Omicron wave had impacted the aging population hard. So we need greater money and people, which the government isn't supplying. They are just not responding, which makes it difficult for us to accept new hospital patients. The Geriatric Care Fund's Itzik Cohen agreed. In 2020 and 2021, the government allocated up to 200 million shekels to private geriatric institutions to handle the coronavirus issue. This year, the Finance Ministry abandoned the elderly in institutions and discontinued the special subsidy. No patient care should suffer, he continued. Over the previous 2 years, Dr. Kobi Haviv, director of Jerusalem's Herzog Rehabilitation Hospital, said, "We have established ourselves as leaders in the treatment of the most challenging patients in the healthcare system. The regular hospitals would be overwhelmed if we didn't treat these folks. It's absurd that financing ends at the height of epidemic. The industry as a whole now needs help." It was launched this week at Herzog Hospital's request, easing pressure on geriatric critical care beds.